Cardiovascular 1 Case Study. We have a 48-year-old female client who presents to the emergency department reporting achiness to bilateral elbows. That is atypical and it's worsened over the last 3 days. She states the feeling has awakened her at night. She reports being short of breath lately and has been under a lot of stress at work. Her respiratory rate is 18, heart rate is 88, blood pressure is 148/88, and oxygen saturation is 97% on room air. The client denies nausea or vomiting, and her skin is moist. Her history does include iron deficiency anemia, C-sections ×2, and an appendectomy. Family history includes her father with an acute myocardial infarction at age 56. So what cues can we pick out of this case study? Realize that our cues are going to be relevant to this particular client and are not necessarily going to include all of the abnormals, and sometimes they will also include the normals. Well, the achiness to the elbows, being short of air, increased stress, elevated blood pressure, moist skin, and the father with an acute myocardial infarction. So let's move on to analysis and potential causes or implications. Achiness to those elbows, what could cause that? Well, these are atypical signs of an MI or myocardial infarction. Women will have frequently atypical MI symptoms, one of which would include achiness to the elbows. Sometimes it's just fatigue. Sometimes it's just shortness of air. So we cannot ignore these symptoms. Could also be caused from injury of some kind or some type of musculoskeletal disease. Being short of air might be a respiratory illness or infection, could be being overweight or congestive heart failure, might be hypoxia. The increased stress, implications of that, this is going to increase the risk for hypertension or an MI or a stroke. That elevated blood pressure could be caused by stress, could be caused by cardiac disease, maybe a high-fat diet because this leads to atherosclerosis or a narrowing of the interior lumen of the blood vessels due to plaque buildup usually caused by those fatty deposits. Moist skin could be the environment, might be too hot. Could be an MI. Diaphoresis is a common symptom of myocardial infarction. Might be caused from an infection, might be running a temperature. And father with AMI, what are the implications? Well, this means that this client has an increased risk of cardiac disease. So what do we do about these things? With the achiness to the elbows, we need to obtain a history to determine if there is potential injury. We need to do different diagnostics for MI, make sure that she is not having a myocardial infarction, or make sure that she is. Or diagnostics for that musculoskeletal disease. If it is an MI, we're going to do the morphine, we're going to do oxygen, we're going to do nitroglycerin, we're going to do aspirin. If it's a musculoskeletal disease, is it due to a bone cancer? Is it due to hypocalcemia, etc.? For shortness of air, we need to put oxygen on. Encourage rest. Elevate the head to expand the diaphragm in the lungs. Give that bronchodilator. Open up the airways. For increased stress, let's do some stress management. Teach those relaxation techniques. Maybe even give medications. For the elevated blood pressure, we may need to give antihypertensive medications. Weight loss is always a good one. That will help lower blood pressure. Giving that low-fat, low-sodium diet, again, the fat can increase the risk of the atherosclerosis, and the sodium can increase the risk of fluid retention, which increases blood pressure. Diuretics might be necessary to also help lower the blood pressure and maybe offload some of the fluids the client may be holding on to. Exercise. Exercise is always good to help lower the blood pressure. What do we do for moist skin? Well, let's cool the temperatures down. Put that lightweight clothing on. Do diagnostics for that MI and infection, and then treat them appropriately. The father with the AMI, we need to educate this client on cardiac symptoms so she knows what to watch for. And encourage that low-fat, low-sodium diet. Also, encourage exercise.